Hey everyone, my name is Derek Weigand. I'm a general dentist in Fargo, North Dakota. I've been doing dentistry and orthodontics for a little over 10 years now, and mostly clear aligners, but also some straight wire ortho. But yeah, I really enjoy it, and really enjoy helping patients reach their goals and get the smile of their dreams. Will people see if I have a retainer? Usually not. No. The If it's permanent, it's behind the teeth. It's on the back side of the teeth, and so it shouldn't be visible unless maybe you were in some awkward position and someone was right up in your face, and they might. I mean, maybe then it would be able to see it, but no. And then the removable retainers typically are only worn at night, and even if you did wear them during the day, oftentimes they're clear, so you wouldn't see them anyway. And maybe that's more of the question was pertaining to aligners. But no, like any of that clear material, if you're a few feet away from someone just having a normal conversation, they really wouldn't be that noticeable. What if my retainer breaks? Yeah, I would get it fixed right away. It's really important, and yeah, you need to see your dentist or orthodontist, or if you're doing a direct-to-consumer type, I would send a message or get in contact with whoever you need to get in contact with to get that fixed, to get it replaced right away. Retainers help with speech impediments. Yeah, I suppose sometimes they can. Sometimes it also takes a little getting used to kind of learn how to speak again when there's something extra on your teeth. But they really are slim and low profile, and so most of the time it doesn't take long to adapt to them. But I suppose for some people, maybe if there was an issue with, the way your tongue presses against the backside of your front teeth is how we form a lot of sounds and a lot of words, and so. I suppose someone, in an instance where like someone might whistle their S's or something like that, that maybe wearing a retainer might help alleviate that. There's some stain-inducing foods or drinks to avoid for maintaining white teeth. Yeah, there's a whole bunch of them, but most of them are pretty common sense. If you're drinking like dark-colored sodas or dark-colored drinks, coffee, teas, red wine, those types of things, all the things you've probably heard before, they really do stain your teeth, and sometimes they stain them fast. So I love coffee, and I kind of just deal with the consequences. But and my teeth, incidentally, are also very sensitive, so I don't love whitening. But it's just as far as foods go, it's kind of the same thing. Anything that's dark, like your teeth, are somewhat porous, and so they kind of attract those stains. They soak them up, and so like I always think of like pasta with red sauce, a tomato-based sauce of some kind. The same thing that makes red wine that stains your teeth. Dark berries, grapes, stuff like that. They'll also do a number as far as staining goes. So our home whitening kits effective in achieving whiter teeth, and how do they work? Yeah, I think we already kind of hit on that. They work well. They work great. And hydrogen peroxide and carbamide peroxide, again, kind of the only ingredients that we work with, and they work very well. And again, just dependent on how much stain you have, and then how compliant you are, how much you can wear it, how much you can tolerate it with the sensitivity and that kind of thing. What steps should be taken to maintain white teeth after using whitening kits? Yeah, just keeping up with hygiene, limiting the things that stain teeth like we talked about, and then, not being afraid to use whitening as a touch-up process where you may do it like every day for a couple of weeks starting out to get the result you want. And then maybe 6 months down the road, or maybe sooner, maybe not, give or take a little bit, but you may have to wear them again for a few days, or maybe even just a day here and there, just to kind of keep things in check. Can teeth whitening alone achieve a perfect smile, or are additional treatments needed? Yeah, no, there's a lot of things that are needed sometimes. It just depends. Depends on the complexity. Some people have active disease in their mouth. If there's cavities or gum disease, like whitening is not going to fix that. And And so, and in those cases, it might even make it worse, and it's certainly not going to be any fun. Those situations can become very painful. So, so yeah, sometimes, also whitening doesn't straighten the teeth. So yeah, there's that question is pretty straightforward. It just, yeah, sometimes you need whitening and you need braces and you need work done, whether it's fillings or crowns, veneers, or whatever. Sometimes there's a whole lot that's needed, but sometimes it's simple too. Sometimes just whitening can have a profound effect, or just straightening your teeth. What are some common misconceptions about teeth whitening? Anyone who thinks that that the results are permanent and going to last forever, I think they might be mistaken in that regard. That it's going to get your teeth, take you from a really, really dark stained shade from years of coffee and smoking and all of those things, all of those habits that stain teeth, to this unbelievable glistening movie star white. It's probably not realistic. And so again, just with anything, there's limitations, and results vary for everyone. Everyone's a little different, and the results vary for everyone. So yeah, it would be those, I think, would be the biggest misconceptions, is that the results are permanent, because they're usually not. What are the potential risks associated with misuse or overuse of teeth whitening processes? Yeah, just mostly the sensitivity. That's the biggest issue. The other would be using too much gel. If you're using the trays, whitening trays, they work great if they're custom, especially if they're custom made, because they fit so tightly against your tooth surface that it just holds the bleach right up against the enamel, and it really works well in that way when it's tight up against the tooth. And so it also, I always remind people that a little goes a long way, and less is more. If you put, if you fill up every little spot for a tooth in the tray, that stuff is gonna, when you push it in, it's gonna squirt out, and it'll go on your gums, and it is not fun. It'll, on soft tissue, high concentrations of hydrogen peroxide cause chemical burns, and it can really be an ugly thing. So that's my biggest caution for folks, is that just be careful. Don't use so much gel. A little goes a long way. What are the benefits of combining teeth whitening with clear aligner treatment? Yeah, it's awesome. I mean, there's huge benefits. One, because you're already wearing a tray in the form of an aligner, a clear aligner that you're going to be wearing at night anyway. And so, why not put some whitening gel in there? And hydrogen peroxide, incidentally, is also a really good disinfectant. And so it's kind of cleaning your trays, whitening your teeth, and moving your teeth all at the same time. So you kind of get a 2-for-1 or a 3-for-1 kind of deal there. So yeah, it's really great. And then also when you finish braces, I think that's one of the hard parts when you take off permanent bonded braces, conventional orthodontics. A lot of times, especially if they weren't cared for properly, when you take the brackets off, the teeth are nice and straight, but then there's stains and there's white spots where the brackets used to be, and it just, sometimes the outcome is, it's not what the patient was maybe thinking. They get to look in the mirror after the braces come off, and they're happy with how straight their teeth are, but then they're thinking, what is all this stain? I have to go through whitening, and I have to go through all of this to try to remineralize the teeth and all of that. So being able to do the two at the same time, when you can, at the end, and you have a big reveal of, with clear aligners, you're looking at your progress every day and probably taking photographs along the way. But when you finally look back at that first photo that you took before you started to the photo that you took on the last day when you finished your last set of trays and your last treatment, it's amazing to see the results. And that's super rewarding for the patient, and from my perspective, seeing it all unfold, it's really beautiful.